Hello everybody, welcome to the webinar. In the previous video, I promised you that I'm going to teach you how the secret memory palace approach is related to your clinical exam, and in this webinar, I'm going to teach you the 7 mistakes done by students in their clinical exam. If you can avoid these 7 mistakes, you will pass your clinical exam with ease. So I want you to give 2 minutes so that everyone can join the webinar, grab a pen and notebook, and make sure you take plenty of notes, and I will grab a sip of water and we'll start the webinar soon. I can tell you with 100% confidence that you are going to love this webinar. Okay, let's say John is a 53-year-old male who has come to your general practice. When you're standing outside the room, you have this scenario that says, John is a 53-year-old male. He has come to your general practice. So you need to visualize that there is a person called John and he is 53-year-old. And this is what I do when I'm reading the scenario outside the room. I'm thinking, okay, John, this is John, and if the scenario says John has been coughing for 3 days, let's assume that today's date is 6th. When they said that he has been coughing, I will visualize on the calendar for 3 days, starting from 6th. So that will be 4th, 5th and 6th. And now if the scenario says that John has shortness of breath since today morning, I will start visualizing that on the 6th, he has shortness of breath. So as you can see on the screen here, the previous slide said that John has coughed from 3 days and today he has shortness of breath. So this is how I visualize everything. So this is John, a 53-year-old male. He has come to you with cough for 3 days. And on the 6th, which is today, he has noted some shortness of breath. So I want you guys to visualize, and let's say he's bringing up 1 teaspoonful of sputum, and now you visualize a spoon with sputum, and if the scenario says if the sputum is blood stained, you have to think of picture like this. I hope everyone understood what I said, and I'll give you another example. Let's say this is our John, 53-year-old male, and if the scenario says he is a smoker, obviously you think of a cigarette in his mouth, and if the scenario says he smokes 2 packs of cigarettes per day, then you will try to visualize. What I usually do is I try to keep 2 packets of cigarettes, 1 on each side of John, and this is how you visualize when you're reading the scenario. Let me give you another example. When someone is giving history to you, you should visualize as well. I use the same strategy when I'm taking history from my patients in real consultation as well. Forget about the clinical exam, that's nothing. When you're really practicing as a doctor or as an intern or as an RMO or a general practitioner or a consultant, it doesn't matter. Your patient is going to tell you history, and as a doctor you have to remember the history. And this is the exact technique I use when my patient is giving me history. Okay, so make sure you practice this. Once you practice this visualization technique, the amount of information you can remember will increase, and you will not miss any point when the patient is giving history. Okay, so that's mistake 1. People don't visualize what is given or what the patient is telling them. This is something I've noted because many people tell me, Dr. Talari, I forgot the history, or I don't remember the scenario that was given outside the room, and that's a big mistake. So make sure you try to visualize when you're reading the scenario, And when you're actually taking history from the patient, try to visualize what the patient is telling. Just listening to this, you will not know anything. You have to go out there and practice with your role players, practice with your wife, practice with your son. Tell them to tell you something. Close your eyes and try to visualize and just tell them back all they told you. Okay, I forgot to introduce myself. I am Dr. Talari and I will tell you why you should listen to me. I passed all my 16 stations of my clinical exam in the first go, and I finished each and every station almost 2 minutes before the bell rang, while everyone were struggling to finish the station on time. I was able to finish each and every station 2 minutes before the bell rang, except one station. I will tell you what that station is. So that is why you need to listen to me, because I have developed lots of strategies and approaches to help pass the clinical exam. Okay, so now we will move on to mistake 2, which is something I have noted lots of students have this problem. Whenever I conduct a workshop or when I go as an examiner for some mock exams, people tell me that Dr. Talari, I have anxiety during my exam. Although I know everything, I was not able to do it, and I'm not able to manage my time. I know the diagnosis, but I forgot it. Okay, so you might be thinking the same, because I had the same problems when I was appearing for my clinical exam. I met this doctor recently and I asked him, who told me that he is very anxious and he is worried that he will fail the exam. I asked him, how many role plays do you do? And he was telling me that he does 3 role plays per week. And I can tell you why he is anxious. When I was preparing for my exam, I used to do 5 to 6 role plays every day. Okay, so once you start doing role plays, you will develop an approach, you will develop a strategy. Your mind is thinking like a machine. So if you're doing that mistake, please don't do that. Try to do as many role plays as possible. Okay, and I used to do, the role plays of scenarios which I used to struggle a lot. Let me give you an example. When I was preparing for my clinical exam, I used to struggle with the girl with menorrhagia, or the teenager who comes to you with amenorrhea, or amenorrhea in a 22-year-old female. What I used to do is I used to go to people and I used to tell them, frame a scenario about amenorrhea. I will give them the option and I will tell them, it's up to you. You can give me any diagnosis you want, and I wanted you to frame me a scenario about amenorrhea. We will do a role play. And what I used to do is I used to go to 4 or 5 different people and I used to tell the same thing to all these 4 or 5 people. Okay, let me have a sip of water. Okay, so I used to tell these guys, I want you to fail me. Okay, I used to go to 4 or 5 different doctors. I will select a topic which I'm struggling with and I will tell them, look, let's do a role play. It's only for 4 minutes. We will only do the history side of things, and I want you to fail me in this role play, and I will give them the scenario. When I was preparing for my exam, I used to struggle with few scenarios. So I used to tell them, okay, you frame any diagnosis for this particular scenario. Let's say a 17-year-old girl has come with amenorrhea. So you can frame any diagnosis as the working diagnosis, and I will take history from you, and I want you to fail me for all the mistakes I do. So I used to do this with 4 or 5 people, and I used to commit all the possible mistakes I can do. Then I go home and I will sit down, open the topic, amenorrhea in a teenager, start reading, then I will get the feedback they gave me saying, you missed this diagnosis, you must have done like this. And I used to write down everything every single day. I used to have a book. I used to write down all these things. And next time when I do a role play, I used to avoid these ones, or I will at least try to avoid the same mistakes. And by doing this, I have actually avoided a lot of mistakes which everyone will do in the clinical exam. Some of you might say, okay, Dr. Talari, you had friends in the hospital system, but we are not working, or we are medical students. How can we do this? Because you don't have access to people who are working in the hospital system. So my advice would be, there are two ways I used to do. One is a free approach and one is a paid approach. I'll tell you the free approach. So what I used to do is I used to go to general practices. Let's say you are in Australia, Sydney, and if there is a general practice there, I usually go there, talk to the practice manager, and tell them I would like to observe a general practitioner for 1 week or 2 weeks. Most of them will say no, but if you ask them in a proper way, if you go and talk to few different clinics, some will say, okay, we will let you observe, but they have to get permission from the general practitioner and the patient as well. So what I used to do when I was preparing for my exam, I used to go to this general practice and I used to observe this doctor. I used to see when he is referring a patient for a blood test, when he is referring a patient for an X-ray or an MRI or CT scan, when is he referring a patient to hospital, when is he talking to the family members. So I used to observe all these things. These are all very, very important. If you are working in healthcare system, you need to know how the system works. There is no point in practicing in a system where you don't know how the healthcare system works. And I've seen candidates or students saying that they're doing role plays with someone they found in this Facebook group. And when I ask them, did that person pass the clinical, or is that person working? They will say, no, doctor, he is a doctor like me who has no experience in the healthcare system. And he has never passed a clinical exam. So this is a very common mistake done by almost 98% of people. And this is the reason why many people fail, because they start doing role plays with people who have no idea about the healthcare system, who don't know when to refer the patient, who don't know what type of antibiotic to start, who don't know when to call the ambulance, who doesn't have any idea about when they involve the obstetrician or when they involve the emergency consultant, and they start doing role plays and they fail because they learn the bad things and do the same thing in the exam and they will fail the exam. So it is very important that you guys should do role plays with someone who knows the healthcare system. I got a bit deviated from this. So go to these general practitioners in your area, and first thing you need to say is, I want to observe you for 1 week. Once you build some rapport with this doctor, then you can ask him to do role plays with you. Let's say you can do few role plays with him and ask him to teach you the common scenarios junior doctors struggle with, or write down all the doubts and ask him, what do you do in this situation, doctor? Let's say if a patient has got this side effect on this antipsychotic medication, what do you do, doctor? Book will tell one thing and clinical practice is different. So you need to know how the healthcare system works. If you don't know that, then I can tell you, you will probably fail the clinical exam. It's very, very important. This is the free way where you will go ask people to teach you. They might teach you, they might not teach you. It's up to you. On the practice, so you might be lucky where someone might say, I will teach you for free, or I will let you observe and you can ask them doubts. Or there is another way which I've never used, but I think this will work. This is a paid way where you go to people who pass the exam and who are working in the hospital system or in general practice and pay them some money, pay them an hourly rate Okay, so don't mind paying them $50 or $30 or $60. I don't know what the doctor will charge you, but go to these Facebook groups and go and post there saying, dear all, I'm preparing for my clinical exam. I'm happy to pay someone, $30 per hour if they are willing to teach me on how to pass the clinical exam, but I need someone who is practicing in the healthcare system. Make sure you do that. Don't do role plays with someone who is not working in the healthcare system. There's no point in doing role plays with someone who doesn't know what the healthcare system is. So make sure you do that. This one is a bit expensive. At least, if you start doing role plays, tell them, I will pay you $30 per hour for 5 hours, and if I have any doubts, I will ask you. Just take their email address, and if you're nice to him after 5 hours, and if you pay all his hourly rate properly, he might give his phone number and you can ask doubts on phone as well. But please don't try to annoy people. I know some people who just annoy me. They get my phone number and they ask every silly doubt, and I'm a busy man. So please don't try to annoy the people. Ask them in a polite manner. Ask them on what time they can be contacted on phone, or get their email address. Send an email saying, doctor, this is the thing I'm struggling with. When should I refer this patient to hospital? Ask something that is helpful to you, and ask something that the person will not think that, oh, this fellow is asking every silly thing, instead of going and reading out there and doing some research. Some people ask me silly doubts, while they can get that if they do some research, and they want to be lazy, and they send an email saying, Dr. Talari, can you please say what this Gillick incompetence is, or when is it called rape in a 16-year-old, or something which is very simple. All I do is I will just tell them, go to this website and do some research on it, because I don't want you guys to be lazy. This is your exam. You need to work hard. Before you ask someone, if you do some research, if you go and check some internet articles, there is a lot of information available. Okay, so make sure you do that before you ask doubts from the person you're paying for. That is one thing I've noted. This is one of the mistake I've seen. So you have two options. One is a free option where you can go to people who are working in the general practice and ask them for observation. Then do some role plays. This is a free way. Or go to Facebook groups and post saying that you will pay for someone who is currently working. Make sure you check that they are working in the healthcare system. Someone who is desperate might say, I'm working, I passed the exam, but they might not be working. So make sure you check that, and then you can pay the money via bank transfer or PayPal or whatever it is. So make sure you do that. Some people might say, I can't afford $30 per hour. You're paying an exam which is going to cost you $3,000 to $5,000. And if you pass this exam, your life is going to be different. And people say, you can't afford $30. So what is better? Is it better to pay someone $5 hours of $30 and total of $150 and pass the exam, or go to the exam with confidence? Or do you think it is better to fail the exam and lose $3,800? It's up to you. If I'm you, I would rather pay that $150 to someone and get some coaching from them. That's mistake 2. Let's move on to mistake 3, which is the approach. Okay, I already covered about this a bit, but I just thought I will explain this in great detail, because it is very, very important. When you are actually entering the room, you should think in a step-by-step approach. Anything in a clinical exam must be a step-by-step approach, and you should have one approach for every particular scenario. I have seen doctors who will have multiple approaches. Let's say they will have one approach for a chest pain case, one approach for a abdominal pain case, one approach for pediatrics, one approach for gynae-obs. And that is why people fail, because they don't have one approach. I passed all my 16 stations in the clinical exam, and all the stations I had one approach, and that approach is what I've released as a course. I have a course that is called OSCE Formula, where I teach you step by step, from the time you start reading the scenario till you finish this station by wrapping up saying, is there anything I can help you with? Or, check how the patient is going home or hospital. So that's the last step in the consult, and thanking the patient. From the time you start reading the scenario outside the room till you finish the scenario, there is a step-by-step approach. So I use this approach, and it was very, very helpful for me. I passed all my stations. My students passed all their stations as well. Some of them, not everyone, because everyone's knowledge is different. So, I will talk about this at the end, but at this point, I want to tell you that you should have a step-by-step approach. Exam is a stressful situation. You're under a lot of pressure. So you need to have that approach, or else you are going to do the mistakes, and you're going to waste your time, and you're going to miss a diagnosis. So the approach is key. And where possible, my advice would be to have some mnemonics. In the approach, I said I'm going to teach in my course the OSCE formula. I have some mnemonics as well. So I have a few things, like when I'm reading the scenario outside the room, there is a A, B, C, D, E approach, which is A stands for action words. You will figure out what the action words are. B stands for blunders. C stands for common diagnosis. D stands for a mnemonic, which will help you not to miss a single diagnosis. E stands for, enter the room by knocking. And once you enter the room, there is a 3-step formula I start with. Then there is a 5-step formula. Then I will go to Tulari's history taking, which is again a mnemonic, and it's a step by step. When you enter the room, you have 3-step formula. You do 1, 2, 3 and you're done. Then you will move on to 5-step formula, which is 1, 2, 3, 4, 5. You will ask 5 questions, you're done. Then you will move on to Tulari's history taking, which is, there's a mnemonic there. And if you go like this, you will have everything on your fingertips. Your time is well managed because you're not thinking for something. You have a step-by-step approach, and you are well organized, and the examiner and the patient thinks that you know what you're dealing with. So it is very, very important to have that step-by-step approach and have some mnemonics. That is the best way to remember things, is to have mnemonics. The best way to manage time, have some mnemonics. You can go out there and start creating some mnemonics for you, or I have already created a mnemonic, and which I will be using in the ABCDE approach. And then after that, when I'm taking history, I have a set of mnemonics, so that you don't forget anything and you will not miss a single diagnosis. You will manage time. I have written all the questions for you. I have researched lots of medical books, and I've written each and every question, and you can actually just write down that question by heart it and go and spit it out in the exam. So you will finish the exam station before time. You will have a very good approach. The most important thing when you have a good approach is confidence. You will have excellent confidence when you're actually dealing with the patient, because your mind is thinking like a machine now. You're not a human being now, because you have this step-by-step approach, and you know that after A, B, C, D, E approach, which is what I teach when you're reading the scenario outside the room, you go inside, next thing you do is 3-step formula. After that, you do 5-step formula. After that, you do OSCE AAA. Then you will move on to PQRST if it's a pain symptom. So everything is written in a step-by-step formula. You can actually go do some research, get some mnemonics and start doing it, or everything is done for you. And at the end of this webinar, I will talk to you about the course. You don't have to buy it, but if you want to save time, save money, and go to the exam with confidence, that course will help you a lot. So make sure you wait till the end. And at the end, if you stay till the end, I will actually give you something as a bonus. So make sure you stay till the end, and that is only for people who stay till the end. So that's approach. Then what is important is I'm actually going through my notes here. I've written down some points. So we will move on to mistake 4, which is not reading the scenario properly. Okay, many students have noticed that they don't read the scenario at all, or maybe they will read the scenario, they don't remember it. See, now I gave you a strategy on how you can remember the scenario, and if you use that particular strategy, the visualization strategy I taught you at the beginning of the webinar, you will not forget anything. So these are the common mistakes done by students. So if the scenario says, John is a 70-year-old male who has come to you complaining of cough, the student is under pressure or the doctor is under pressure. So once he goes inside, he will say, Mr. Smith, how are you today? I am Dr. Talari, pleased to meet you. Okay, this is a standard opening statement I use, and in the course I will be teaching you the standard statements. If you just by heart those statements, there are some transition statements, I will be teaching. If you just by heart them, life is easy. You will be going smoothly during the history taking, examination, investigations and management. Okay, so people say that they enter the room and say, Mr. Smith, how are you today? I am Dr. Talari, pleased to meet you. Okay, but the patient name is John. His name is John Anderson. This is a mistake I've noted, a few days ago. Then I asked this doctor after the exam, why did you say Mr. Smith? He said, Dr. Talari, the previous scenario was Mr. Smith, and I was still thinking about the previous scenario. See, what happened to this particular doctor when he said, Mr. Smith, how are you today? The patient said, Doctor, I'm not Mr. Smith, I am John. And that was a big bouncer for him. And he lost control over the station at the beginning of the scenario, because this is something he did not expect from the patient. Okay, so he lost that rapport with the patient, because now the patient is thinking, this doctor doesn't know my name as well. And the examiner is thinking, this doctor did not read the scenario properly. So make sure you don't do the same mistake again and again. Okay, so this is a very common mistake done by doctors. There was a big mistake one of my friend did when he appeared in his clinical exam. He did not read the scenario properly. The scenario says, patient is XYZ, take history, explain the differentials to the patient. But my friend, because he was under pressure, he actually explained the differentials to the examiner instead of explaining them to the patient. So once he finished explaining all the differentials to the examiner said, okay, that's great, doctor, why don't you explain the differentials to the patient? Because the scenario says you have to explain the differentials to the patient. And the bell rang and he had to leave. He thought he did well, but unfortunately he failed that particular station when he got the feedback few weeks later. So some examiners are like that. If you don't read the scenario properly, you will most probably fail, because you are not addressing the tasks that are given in that particular scenario. So it is very, very important. So make sure you read the scenario properly. That's one mistake I've noted. The other mistake I've noted is many people think that, this is a recall in 2014, or this is a question in one of the book I have read, and they will be biased and they will think, this patient has come with abdominal pain, so this is cholecystitis. While the examiners are smart, they will change a few minor things in the scenario, and they can make this scenario like a let's say gastric ulcer perforation, or they can make it appendicitis. They will keep everything the same. So what I mean to say here is, don't be biased. When you read the scenario, go open-minded. Start taking history, although you know that this is a recall case, or you know that this scenario is from a book you read recently. So although you know that, make sure you go open-minded and try not to be biased. Just start taking history as if it's the first time you're reading the scenario, and make sure you actually be open-minded. That's very important. You can never be biased, because even in real life some doctors will be biased thinking this patient has appendicitis, while they might have something else. So you might do an unnecessary referral to the hospital, or you might not refer a patient who needs a hospital referral. So my advice, please don't be biased. Read the scenario carefully, go open-minded. Mistake 5 is poor communication skills. When I was preparing for my clinical exam, the consultant told me local graduates who have English as their first language work on communication skills. If you are an international medical graduate, you should do a lot of practice on your communication skills. See, I was an international medical graduate. I was not from an English speaking country. So what I decided is, okay, so people struggle with communication skills. So how can I actually improve my communication skills? What I did was, I started writing down all the questions they ask in the clinical exam. Let's say the first question you ask the patient when you meet a patient is, you say, I am Dr. Talari, pleased to meet you. So I read some books and noted down few questions where the standard opening statements are, how can I help you today, what brings you here today. Okay, so these were the best statements I've seen. But I personally like the help, how can I help you today, because as a doctor your role is to help your patient rather than saying what brings you here today. I chose that because I like that particular statement, because you are actually forming a mental bond or emotional bond with the patient, saying you are here to help the patient. So I use the same statement with all my patients. In all my exam stations, I use the same opening statement. I am Dr. Talari, pleased to meet you. How can I help you today? Okay, that's my standard opening statement. And let me give you another example. Let's say you have to take pain history in a patient. So as I said before, I always remember things with mnemonics, because you will not miss anything. You will be very confident. You will have a step-by-step approach. So I read a book, and in that book there was this mnemonic called PQRST. Probably everyone knows this, but I will tell why this is important. So I read this book. I've written down all the questions from that particular book, because PQRST is place. P stands for place, Q stands for quality of pain, R stands for radiation, S stands for severity, T stands for timing. Okay, many people, they try to actually frame a scenario in the exam situation. Even though English is your first language, when you are under pressure, you struggle with forming a sentence. I think you have to agree with me on this. Even though you are born in an English speaking country, you will still struggle when you are under pressure. That's why people have slurred speech when they're on stage, or they panic and they talk fast. They do things like that when they are under pressure. So what I did was, I by hearted these 5 questions. P stands for place. So you will ask the patient, Mr. Smith, can you please show me exactly with one finger where the pain is? Okay, so I've written down this question. I read it 30-40 times, and now I remember this. If you wake me up at 3:30 in the morning and say, what is that question you ask for place when you're taking pain history, I will tell the same question. Then Q stands for quality of pain. Okay, what type of pain is it? R stands for radiation. Is the pain moving anywhere? Make sure you don't use jargon. So any question you ask should be in simple layman English, because you will be losing marks when you use a lot of jargon. Like if you say, is the pain radiating anywhere? Some people might know what radiation is, some people might not. So use simple words like, is the pain moving anywhere? Okay, then S stands for severity, where I will ask the patient, how bad is the pain on a scale of 1 to 10? 1 being the mildest and 10 being the worst pain you have ever had. Okay, so see this. I have by hearted these questions, and anytime I take pain history, I will ask the same questions. Okay, so the patient and the examiner will think, oh, this doctor's English is very good because I have by hearted them. Now I'm not talking like a person, I'm talking like a machine because everything is programmed in my brain. And once you have this program in your brain, you will not do mistake. There is another strategy I used to do. What I did to remember all these questions is I've written down all these questions in different colors. History of presenting complaint, these are the questions I ask. Then, history of differential diagnosis, which is what I will teach in my course, these are the questions I ask. Okay, then transition statement, these are the questions I ask. The first statement in examination, this is the question I ask. The last statement in examination phase, this is the question I ask. After finishing examination, this is the question I ask. So I've written down all these in different colors, and I've written down 4 different sets of them. I have pasted them in every room, like in the toilet, in my bedroom, in my living room, and in my study room. So I used to have 4 rooms when I was preparing for my clinical exam. I pasted all these questions in the same colors. Again, as I said, I try to use a lot of memory strategies. So I did all these things, and every room I go, let's say I'm brushing my teeth, I don't waste my time. I'm just looking at all the questions, and every day I look at all these questions. And now, because I'm using few memory strategies like visualization and photographic memory, all these questions are recorded in my brain, and I see them every day, which is again a memory strategy. Repetition is a memory strategy. So I see them every day. So now in every room I go, let's say I'm sleeping, I just before I sleep, I will quickly look at all the questions and sleep. When I wake up, when I'm brushing, I quickly look at all the questions every day. If I'm studying, before I sit in front of my books, I will go there, look at all the questions. So every day, probably I will look at these questions 7 to 8 times, sometimes 10 times. If I'm getting bored, if I will not do anything, I will just listen to some music, stand in front of the questions, and I will be reading the questions again and again and again. So now with repetition, I remember everything. Okay, had a sip of water. Okay, that's how you improve your communication skills. So I did lots of practice, and you should have standard statements from the beginning of the scenario till the end of scenario. Like, what is your opening statement? Then if a patient comes to you with pain, what is the empathy statement you're telling him? If after he tells you something, what are the empathy statements? Before you start the consult, what do you tell with a pain patient? These are very, very important because that's how you build that rapport with your patient. And what are the transition statements you use when you are moving from history to examination? And what is the transition statement you use when you are moving from examination to investigations phase? Then after investigations, what is the transition statement you are using to move on to management? And what is the first thing you do in management? And what is the last thing you do in management? These are very, very important, because once you have all these things written down, like a cheat sheet or like a map. Let's say you're entering a forest. If you have the map, it will be very easy for you to reach the other end of the forest. But if you don't have a map, think about it, how difficult it is. In my opinion, clinical exam is also like entering into a forest, because you don't know what is going to be there. You don't know what the diagnosis is. You don't know what the scenario is. And it's time based. So you should develop your communication skills. You should have standard statements, and you need to practice them a lot. Make sure you use all the strategies I've taught just a while ago, and that will be very helpful for you guys. And in my course, I have given each and every statement. What is your standard opening statement? What do you say when someone comes to you with pain? What do you say when someone tells doctor, I did not sleep properly? Or what do you say when someone comes and says that he is anxious? Okay, so everything is given in the course. So I will tell about the course at the end, but I want to teach you the importance of communication skills now. Then we will move on to mistake 6, which is not experimenting. When I was preparing for my exam, because I knew that this exam was a time based exam, I used lots of strategies to help me remember things by trying and doing lots of experiments. Let's say a child has come to you with a rash. Okay, if the person tells me, doctor, the child has this rash, and you take history, examine the child, and manage the patient. If that's the scenario, the role player tells me, what I used to do is, instead of saying, okay, let me start the scenario, I used to tell my friend or role player that I will do the scenario, but I will go backwards. Okay, so I will explain what it is. It's a bit funny. My friends used to think that I'm crazy guy because I was doing this thing, but it worked. At the end of the day, whatever works is going to help you in the exam. So what I used to tell him is, I used to tell him, okay, so we have 4 phases in the clinical scenario. The first phase is history, second phase is examination, third phase is investigations, fourth phase is management. Okay, so I used to tell my friend or role player that I will do role play from the back. Okay, so let me give you an example. Let's say if my friend tells me, okay, 4-year-old child has come to you with a rash, your tasks are take history, examine the child, and manage the patient. Okay, so I used to tell him, okay, forget about examination and management. I will do the history bit and I will do it backwards. So instead of starting the scenario like, hi John, I am Dr. Talari, pleased to meet you. How can I help you today? I used to go backwards. I start with the last statement of the history, which is the consent. Okay, without asking consent, you should not move on to the next phase, which is the examination phase of the OSCE exam or the clinical exam. Because if you're not taking consent, that's rude to examine a patient without taking consent that you want to examine him. Okay, these are very, very important things. So what I used to do is, I used to start backwards, where I will say, John, I finished taking history from you. I would like to examine you. Is that okay with you? See, I'm starting from the back. After that, I will move on to, whatever mnemonic you follow, or whatever, approach you follow. I go from social history. So after the consent, I will ask about social history, like how are things at home? Whom do you live with? So after that, I will go to family history, then past history. Then I will go to allergies, medications, and history of differential diagnosis, history of presenting complaint. Then at the end, I will introduce myself to the patient, which means I'm not going front to back, I'm going back to front. I will do the same thing with examination station, and I will do the same thing with investigations, and I will do the same thing with management. Okay, so there are lots of standard statements I use, and that's the only reason I was able to finish the exam faster, because I have all these standard statements and I have by hearted them, and all I have to do in the exam is, okay, finish the introduction bit, okay, showed empathy, then 3-step formula, then 5-step formula, then this mnemonic. Okay, this is a pain symptom, so this mnemonic. So everything is a step-by-step approach. And if you use the experimenting strategy, you are actually training your brain to think under pressure. And when in the exam, when you're under pressure, your brain can start thinking, because you have trained your brain to think front to back, back to front. If you want, you can try whatever you want, but make sure you do something like this. Initially, what I used to do is, I used to write down everything, the entire history pattern on a piece of paper. Then I used to go back to front, front to back. And after few role plays, I started doing, with other people without looking at my cheat sheet. Okay, so this is a very important strategy. If you do this, I can tell you with 100% confidence, you will manage your time well, you will not miss anything in the history taking, and you will be very confident in the exam like how I was. So that's mistake 6. Okay, mistake 7 is not knowing the OSCE chain of survival. Okay, you might not know this because it's not given in any medical book. This is something I have created because I used to have this chain of survival, same to the ALS or BLS, basic life support course or advanced life support course. We have this chain of survival. So you will have a a chain where you move from one phase to other phase. I was thinking, what can I do so that I will not miss anything, in the clinical exam. So this is the chain of survival. Okay, this is Talari's chain of survival. So you're standing outside the room. S stands for scenario there. Okay, you're reading the scenario. Then in the chain of survival, you will move on to R, which is building rapport and winning patient's heart. Okay, this is where you use the 3-step formula, you use the 5-step formula, because there are lots of communication skills used in that R bit of the chain of survival, because you try to build rapport with your patient before you take any history. That is very, very important. I use the same strategy when I deal with my patients in real life, and the patients love me because before I talk anything, I will build that rapport with the patient. You should win that patient's heart. It's very, very important, and the patient will love you. And if the patient is going to mark you, you will get more marks because he loves you. If the examiner is in the room, he will love you as well because he will never do such things in his daily life. Then once you build the rapport with the patient, you will move on to history. In the history, we will go step by step. Then you will go to general examination, focused examination. You will rule out the rest of systems. Then in the chain of survival, you will move to investigations. Then you will move to management. Then you will move on to follow-up. Okay, this is a sequence, and you have to actually follow this particular pattern. It's very, very important that you actually follow this, as this is going to save a ton of time, and you will be confident in the exam. You will not miss anything, and you will pass the exam without any problems if you just follow this chain of survival. So when you're reading outside the room, you should have that brainstorming formula, the ABCDE approach. Then you enter the room, build rapport with the patient, use the 3-step formula, 5-step formula, empathy statements, transition statements, then history, lots of open-ended questions which I teach you, the mnemonics, then consent, which is transition. You move on to, examination phase of the OSCE. Then you will move on to investigations. There is a transition statement I use there. The flow in the clinical exam should be a smooth and it should be a good transition rather than jumping up and down. Make sure you remember this picture. This is something I paid a few $100s for a graphic designer to do this. So if you have a phone, you can take this picture. Make sure you use the same approach, and this is going to help a lot with your clinical exam. Okay, so with this, the 7 mistakes are done. I said that I will be talking about my course. So what I'm going to do now is I will show you how my course looks like, and usually the course will be sold for $97, but only for those people who are on this webinar, I'm giving a special discount. But the discount will not last longer. You have to be quick, and there are lots of bonuses as well. So make sure you actually click the link below this video or to the side of this video, and make sure you check the course, because the actual price is $97, and I'm going to increase the price once the timer on the page hits 0. So make sure you actually visit the page. If the course is not $97, make sure you buy it, because it will save a ton of time and you will be very confident. You will not miss any diagnosis. You will have a step-by-step approach for you to practice, and you will be very confident when you go for the exam. Once you purchase the basic course, you will get the advanced courses. If you don't like the advanced course, don't worry, just click the no thanks button on the page. But the advanced course is where I have done role plays with my students and I have recorded them, and all these students are working in the healthcare system. They know the system better, they pass the exam. So it's always good to learn from others people's mistakes than going there and doing those mistakes yourself. And there are lots of bonuses for the advanced courses as well. So make sure you actually purchase this course before the timer hits 0, because I'm increasing the price of the course and you will lose the special discount price. And once you buy the basic course, the advanced course will be there. It is up to you, it's optional if you want to buy it or not, but that's again on a special price. The price will be increased once you leave that page. So make sure you look into the basic course, which is the OSCE formula, which is the step-by-step formula. I'm going to teach everything in the course. After that, in the advanced courses, I'm going to teach the role plays, where I've done 60 role plays with my students. I've recorded them and I've uploaded the role play video. Then I've given the feedback on what mistakes they have done. You will learn a lot just by listening to these role plays. Write down all the mistakes people have done, and if you can avoid those mistakes, I think you will be very successful in the exam. What I usually do when I was recording those role plays, what I did was I used to write down all the mistakes the doctor was telling. Then I have uploaded a video saying these are all the mistakes the doctor has done. He should avoid these mistakes. Because he did this mistake, he will fail the exam, or these are the key points which you have to follow in the exam. And this is going to save a lot of time, because if you can avoid all those mistakes, then your chances of passing the exam are high. So I strongly advise you guys not to reinvent the wheel. If you want, you can actually go there, buy all the books, sit down with all the books, write down all the questions they have, and try to fit all the mnemonics there and figure out a formula. Or for the lowest price, you can actually get everything, save time, go to the exam with confidence, have this approach, have these strategies, and pass the exam with confidence and flying colors. With this, I thank you all for actually attending this webinar and listening to this webinar. I hope you learned a lot. Make sure you share the page with other friends if you think the webinar was helpful, and if my course is helpful. And I wish you all the best. Thank you very much.